I'm really excited to introduce you to our next guests here today because never have I seen the point that we make about neuropathy here and foot problems so beautifully illustrated, and then what can be done about it is in this guest. Ellie Love is her name, and Dr. Nicholas LaHood is the doctor treating her. First off, doctor, remind everybody what neuropathy is, because there's probably folks sitting at home with symptoms right now and they don't even know what to call it, and they just think, oh, there's nothing really seriously wrong, but it gets worse.
It does, Mark, and neuropathy is nerve damage to the feet. It shows up as a tingling, numbness, burning, or it can feel like there's a tingling in your foot with pain.
And it's sometimes it's associated with diabetes, but not always.
There's a lot of different causes for it, but in the big general scheme, it's nerve damage to that peripheral nerve system.
And if it's not treated, where does it go?
The nerve deteriorates further, and the patient goes down a very bad spiral of deterioration. And we found an amazing way to stimulate the nerve naturally without using any drugs or no evasive techniques to get the patient back to a healthier state.
So let me talk to Ellie now, because I had such a good time visiting with you over here.
Thank you.
You love to dance, you were telling me.
I really
And
do
I just
love
met
to
your
dance.
husband. I said, are you a dancer too? And he says, oh, yes.
You better be.
Okay. Between the two of you.
Yeah, we love to dance.
But you were telling me that you started noticing something very odd with your feet, but I love the way you described it, because some people will be able to relate to this.
It was like I would get up in the morning and step out of my bed, and I'd have like little worms or ants crawling on the bottom of my feet.
Oh.
And yes, it was a very strange feeling, and so we wondered what was happening with that, and went on for a little bit, and then we went to a podiatrist.
Right.
And I said, do I have neuropathy of the feet? And he said, no, you don't have neuropathy of feet. But it still kept happening to me, and I couldn't wear a lot of my shoes. And so one day my husband was looking at the paper, and we happened to see the ad for Happy Feet, and where we could go and get 2 free treatments to see what was going on. So we did go there. We went to San Diego, where Dr.
It's right down on Mission Center Road, right in the middle of San Diego.
It is.
Now, folks, you see it on your screen. For the first 25 callers, absolutely free exam, 2 free treatments, just like Ellie got. Doctor, do you hear this sometimes, that it is misdiagnosed or failure to diagnose when people come in? Because she was told she did not have neuropathy, but once we talk about the treatment and the end result here, I think you can make a pretty good case.
You know, there's clear evidence clinically that there was sensory damage occurring to the nerve, and we started off by gently stimulating the nerve. We took her through the neuropathy protocol that we have.
Well, let's take a look at that, and you can talk about that, about what the program actually is.
So stimulating the nerve tissue non-invasively after a thorough exam, using our deep tissue laser therapy to open up the microcapillaries and bring better blood flow to the feet. The end result is going to be a very, very happy feet for her.
So this is the exam here. You're still in the process of doing the exam, but there's a foot bath that involves a mild stimulation. What did that feel like, Ellie?
Oh, it feels so wonderful. It's just nice warm water, and it's in there moving around on the feet, and it really, really feels great.
But there's a mild electric stimulation that's involved with this, right?
It's a 7.8 hertz of a light electrical current. So it's basically acting as a pacemaker for the nerve. And her nerves were not functioning sensory-wise properly. So this foot bath that we used calmed her nerves down. Now she's able to dance without pain. She's able to just stay as active as possible.
Now, folks, again, for the first 25 callers, the exam is free. The first 2 treatments are free. That'll give you a full evaluation of whether or not the program works for you. Ellie, I don't want to embarrass you at all. Do you mind if I tell people how old you are?
I don't care.
You don't? You sure you
No,
don't
I
mind?
don't
Because
mind.
okay, because I want to illustrate the point here. You are active as can be. You love ballroom dancing, you and your husband, and you're 80, how old?
I'll be 87 in April.
You'll be 87 in April. And I've got to say 87 years young. I mean, that's
Thank
just a
you.
So folks, I mean, the lesson
you.
here is you want to be active through your entire life. You want to be 87 years old and still dancing or playing tennis or golfing or hiking or playing with the grandkids, whatever it is. the doctor can help you with that. So if you have any of these symptoms, please give them a call. The first 25 callers absolutely free for 2 free treatments. So, Ellie, thank you so much. Dr. LaHood, thank you.
Thank you.
Okay, for more information, you go to san diego6.com and you click on San Diego Living.